Shelly. I'm going to be working with you today. I'm a student PTA. I understand you're having some back pain from your herniated disc.
Yes.
Okay, we're going to see if we can help that today. What we're going to do is we're going to hook you up to this machine. It's a traction machine. What we're going to do is try to stretch out your back a little bit. That way maybe it relieves your strength and helps you. I'm going to just explain it as I go, so if you have any questions, just feel free to let me know, ask. But I'm going to have you stand up so I can hook these belts on you. We're going to put this bottom one on, and it's going to go on the top of your iliac crest.
That's what I'm saying too. I think we're saying the same thing, but we're saying them differently.
And we're going to make sure it's tight.
We're going for the same goal.
Okay. And there, we're going to put this one on the table around
on the other machine,
top of it, and we're going to try to make it go around ribs 8 through 10 above here. And ideally, we would have the patient remove clothing, and this would be applied to the skin.
I don't have a pad for the ground, and I don't know whose pads these are, but I'm fixing them.
There we go. Alrighty, and if you could lay down for me, please. There we go, and if you could get in the middle of the table, and we want the back of your hips on this line of the table, if you could, there we go. I'm going to just tighten these up a little bit while you're laying down. That too uncomfortable? No? That's okay. Okay.
What we're going to be doing is we're going to try to get a contraction.
There we go. We're going to hook you up at top here.
That's just means out. Means muscle? The muscles around the neck. I have these self-heat pads right here.
We're going to pull the hair off.
They probably will. You're pretty hairy over there. Beastly. So first I might actually find
we had these.
I might actually have some track. You know, out there one right here at this point. This is the fastest medialis obliquus. Right there. Very just superior and medial to the knee. Kneecap. The next point you're gonna have more up on the rectus.
There we go. You're hooked up there, and I'm gonna hook you up.
So this is for relaxation. That would be a replacement for their tendon contraction. It'll make their arm go up, so they're trying to relax and make the neck apply. So that's what you're saying too, right? Mr. Reader. So when they're increased,
there we go. You know what? First, I'm going to have you raise your feet up. If you can, I'm going to put this underneath. There we go. Because we want your feet, your knees at 90 degrees.
So you're trying to do relaxation.
Is that comfortable? Do you need a pillow underneath? It's comfortable.
Well, that's not how it is. If it's relaxation.
Hang on, let's leave it right there.
That's good.
And we want the angle of
Turn it up just
the rope that we're hooking to the lumbar traction to be about 18 degrees.
First off,
I'm feeling it.
Can you scoot your booty down just a little bit?
the ground.
What were you doing on that note?
No.
Because that made it feel better.
There
It was
we
on
go.
continuous.
Which is what you would use to find a good intensity.
Yes.
All right, are you comfortable?
Yes, ma'am.
Okay. That looks about 18.
I don't
If you want to
feel
come over here, we're
You will.
going
It's on the 50
to turn on the machine. There we go. And right here, we want it to be on for 7 seconds and off for 7 seconds. And we want the step up to be on 1. And down here, we want all of these on intermittent. That way, the traction pulls for a little bit and then goes off and gives her a break. The poundage or the dosage that you use for lumbar traction is 25 to 50% of the patient's weight. So we have calculated that roughly 25% of this patient's weight is 30 pounds. So we want to start her, since this is the first session on traction, we want to start her at the lower end. So we did 30. And then it goes to 1 minute or to 1 pound. And then we want to make sure it's on lumbar. And then we can set our treatment time for 5 minutes. Okay, do you have any questions or concerns before we get started?
Should this hurt?
It shouldn't hurt. If it hurts or you feel uncomfortable, I'm going to give you this little bell, and you can just push it, and it will get my attention. Okay, okay. All right, and I'm going to start it. And also, when it'll go all the way up to 30 pounds, and then when it goes to the off time, it goes all the way back down to 0. We're going to undo this table and separate. But we can wait for that to happen. Okay, it just now reached the, are you feeling anything? Is it feeling okay? Just a gentle stretch. Okay, and it's starting to decrease.
Oh. How about those squats? I'm helping it. I don't have to help them too much.
Okay. There we go. And then you would just do this for the treatment time. Okay, and for time's sake, and to pretend that you've gone through the 5 minutes, next time it goes back down to 0, I'm going to take it off.
Well, I'll take it back and pass down the thing.
I wish we did. Those are brand new pads. Oh. All right. I'm going to go home now. See you.
And turn the machine off. And we're going to let the patient lay here and recover for about 3 minutes. And then after 3 minutes, we're going to take both ends off of the pulling device. And let her stay here for another 3 minutes just to recover and make sure every equilibrium is corrected. Let's have you on here getting tight. There we go.
Don't worry about it. You can edit that out if you want to.
Can you lift your feet, please? Do you have any questions or concerns with today's treatment?
No, ma'am.
Okay, well, thank you.